For all the latest updates, subscribe to News 9.
The world once again saw the biggest single-day rise in the number of coronavirus cases. With 2,28,102 cases, the global coronavirus tally has now breached the grim milestone of 12 million mark. The World Health Organization has shown optimism regarding the control of the deadly contagion. WHO Chief Dr. Tedros has said it is still possible to bring coronavirus outbreaks under control.
Only aggressive action combined with national unity and global solidarity can turn this pandemic around. There are many examples from around the world that have shown that even if the outbreak is very intense, it can still be brought back under control.
Countries like Italy and Spain, which were battered by the deadly contagion, have shown that the virus can be controlled. WHO cited the example of Asia's biggest slum, Dharavi. Even India's biggest slum, Dharavi, has shown that the contagion can be stopped through aggressive action. WHO chief also lauded the efforts of authorities in curbing the spread of virus in Dharavi.
Italy, Spain, South Korea, and even in Dharavi, a densely packed area in the megacity of Mumbai, a strong focus on community engagement and the basics of testing, tracing, isolating, and treating all those that are sick is key to breaking the chains of transmission and suppressing the virus.
Health experts have claimed that Dharavi managed to flatten the curve by the end of June. Testing, massive screening, identifying patients and their high-risk contacts and isolating those who tested positive from the community has done wonders for Dharavi. While Dr. Tedros showed optimism in bringing the virus under control, Dr. Michael J. Ryan made a contrary statement. Dr. Ryan, the head of WHO's emergencies program, said it is unlikely that coronavirus can be eradicated or eliminated.
Once lockdowns were ended, that there was always the risk that the disease could bounce back, because if the virus is present, it will potentially take all opportunities to transmit. In our current situation, it is very unlikely that we can eradicate or eliminate this virus. There are very particular environments in which that can occur, island states and other places, but even they risk re-importation, and we've seen countries who've managed to get to zero or almost zero re-import virus from outside. So there's always a risk, either from within or from bringing disease back in.
The pandemic is accelerating and the world is being tested to the core. Dr. Tedros also affirmed that coronavirus is not the only danger which is threatening livelihoods.
We're all being tested to the limit. For those in poverty with little or no access to quality health services, it's not only COVID-19 that threatens lives and livelihoods. Other diseases like measles, polio, and malaria all thrive when immunization is paused and supply chains for medical supplies are interrupted.
According to the WHO, the easing of restrictions can lead to the deadly resurgence of the virus.